Hi, today we are starting Chapter 5, Stress and Physical and Mental Health. I think you'll find this chapter to be very interesting since we've all experienced different levels of stress. It also is going to talk about fear and panic disorder and some anxiety disorders. When we talk about stress, we've got two different ways of looking at it. First, stress can be defined as the external demands that are placed on an organism, but it can also be defined as the organism's response to these demands, both the internal biological response and the psychological responses. The DSM has recognized stress as a significant component of several different diagnostic categories. If you look in the DSM-5, you'll see a category of trauma and stressor-related disorders. When we talk about stress and we talk about some factors that create a predisposition to stress, this would be the lack of external resources and social supports, the individual's own stress tolerance, the individual's perception of a stressor, life changes, experience of the crisis, and nature of the stressor. And as we go through and talk about these things, you'll see that what may be stressful to one person may not be as stressful to another based on several of these factors. Some key characteristics of stress involve the severity of the stress, the chronicity of the stress, meaning how long does it last, the timing of the stress, does it happen when you've already had two or three other very stressful things happen, the degree of impact, the level of expectation. Did you kind of know this was going to happen, or did it just hit you out of the blue? And then the controllability, whether you really can control it or at least you feel like you have some control over it. When we talk about stress, depression, and the immune system, we see that depression occurs and is associated with a compromised immune function beyond the stressors that precipitated the depression. So, direct correlation between stress and depression. Stress and physical health. Many psychological factors can affect the relationship between stress and your health. Um, are you an optimistic person, someone who just naturally sees the best in things? So a person's optimism and or their negative effect can affect the relationship between stress and health. Cardiovascular disease is also related to stress. Study in this area includes hypertension, coronary heart disease, and other risk and causal factors. When we talk about risk and causal factors in cardiovascular disease, we see that certain personality patterns are linked more strongly to the development of cardiovascular disease. We're probably all familiar with the type A personality, the red-faced, about to blow their top person. And then we also have the type D personality. And both of these are more prone to cardiovascular disease. Treatment of stress-related disorders. We have biological interventions and we have psychological interventions. When we look at the biological interventions, there are surgical procedures, we can have lipid-lowering medications, aspirin or other anticoagulants, or antidepressant medications. All of these will work with your cardiovascular system also to help with the effects of stress. Psychological interventions involve emotional disclosure. This could be coming to a counselor and sharing and just, talking about some of those emotional things. The use of biofeedback, the use of relaxation and meditation, and cognitive behavioral therapy. And remember, in cognitive behavioral therapy, when we looked at those cognitive distortions in cognitive behavior therapy, we're correcting some of that wrong thinking or the way that we look at things, and so that can directly be used in dealing with stress, because remember, part of stress was the person's perception of the stressor, so those work hand in hand. Some DSM disorders are triggered by exposure to stress. So this person may have a predisposition or may have a lot of the other elements, and then stress becomes the trigger for the disorder to develop. Two of these are adjustment disorder and post-traumatic stress disorder. Adjustment disorder is a maladaptive response to a common stressor within 3 months of the stressor, and the symptoms tend to disappear when the stressor ends or a person adapts. We see this when there's been a move, a job change, a divorce. I mean, it's exactly what it says, trouble adjusting. And so a lot of times the stressor doesn't necessarily end, but the person adapts to the new situation. Post-traumatic stress disorder. We hear PTSD most often used when we're talking about military or someone who's been in war, but it can be people who have gone through hurricanes, fires, bank robberies, other traumatic experiences. The rates of PTSD after a traumatic experience we see, as I said, directly related to military combat, prisoners of war, people in concentration camps or tortured, traumas caused by human intent or accidents or natural disasters. Some of the causal factors in post-traumatic stress disorder may include the nature of the trauma. Was it war? Was it natural disaster? Was it some unexpected accident? The individual risk factors and the sociocultural risk factors. How do we prevent and treat stress disorders? First, some things we can do is make sure that the person has a good psychological debriefing. Even in the case of a bank robbery, sometimes I'm called to go in and just kind of debrief and work through some crisis intervention things with those who experienced this scary time. There's challenges in studying crisis victims because they may be reluctant to talk about it because of they don't want to experience those feelings again or that loss of control. But it can lead to trauma and affect their physical health. So how are we going to treat stress disorder? There's been several different treatments or approaches. There's telephone hotlines if someone just needs to talk and they prefer to kind of do this anonymously, and they could do this numerous times. There's psychological first aid, which would include counseling. A lot of times groups are helpful for this, and then crisis intervention. Psychological debriefing. Some of the strategies that we use for relief of PTSD symptoms include critical incident stress debriefing. This is what I was mentioning, like with the bank robberies and different things. We can also use medications and then cognitive behavioral treatments. And remember, cognitive behavioral, we're changing the way a person thinks about something that has happened, and we can find some relief that way.